All right. Greetings and welcome or welcome back. If this is your first time tuning in, hello. My name is Dr. Robisa and I welcome you to the For Health Scholars channel. On this channel, I show current and aspiring healthcare professionals how to one, quickly and successfully earn their degrees, and two, how to start, build, and ensure profitable careers within the business side of the healthcare industry. So if this sounds like a mission that you want to align with, then I highly encourage you to subscribe to the channel. We're trying to hit that 5K mark, but definitely join our community. It is a pleasure to always have you here. Now, today marks day 12 of a series that I'm calling Careermas, and we're almost hitting the final stretch. And so I am very much live tonight. So if you're tuning in live, just let me know that you're here to where you're tuning in from. And if you have any questions, of course, you can drop it in the comment section. Tonight, I'll do a Q&A. I find that many people like when I come on live. So I've been doing that. It's a little easier for me as well. So I'm excited to be here tonight. And so the job or choice that we're talking about is the Occupational Health and Safety Specialist. Now, this is a career specifically for individuals who enjoy or are interested in the employee health management side. So, like I always tell you all, that the healthcare space or the healthcare industry, it is multifaceted and it is definitely complex at times. And like every area of the healthcare industry needs a workforce. And so, even when it comes down to managing the healthcare workforce, we need a team of people to make sure that our population of workers are healthy. And so that is what an occupational health specialist does. And we're going to talk about that in great detail tonight. I'm going to give people a few minutes or not minutes, but a few seconds to join in. Let me know where you're tuning in from. Okay, I see somebody here in the queue. They're coming in from LinkedIn. So let's see. We have Dr. Ken from Canada. Okay, hi, Dr. Ken. Welcome. It's a pleasure to have you here. I don't think I've seen you before, but thank you for joining tonight. And as I stated, I am very, very much live. So if you have any questions, you can drop it in the comment section on both LinkedIn and YouTube. And once I get to the Q&A part, I will be more than happy to answer your questions. So like I said, we are talking about an occupational health and safety specialist. And specifically, this is a occupation for individuals who are interested in employee health or employee health management. Oh, let's see. I have Lakeisha. Hi, Lakeisha Smith from Memphis. Hi. It's such a pleasure to have you here. I don't think I've seen you before either. So this is exciting that we have new scholars coming into our community. Welcome. All right, so I'm going to go into the presentation and then I'll come back and do some shout outs. Okay, so what is the first thing that you should know about an occupational health and safety specialist? Well, this is an individual which really is focused in helping healthcare organizations keep healthy working environments. And like I said earlier, it is not just the healthcare industry is not just about serving patients, but we have to make sure that our workforce is also equipped, healthy, and capable to delivering patient care. And your occupational health specialists, they are very instrumental in ensuring that we have healthy work environments. Now, in this role, which is also abbreviated as OHS specialist, they can work in a variety of areas, but their core goal is all about safety, maintaining the environment, making sure that things from down to the equipment that we use is safe, to the lighting in the office, it's appropriate. So just keep those things in mind. And with an OHS specialist, you play a very crucial role in safeguarding the well-being of employees. So making sure that employees are capable of working, so having their vaccinations or making sure that they're healthy, making sure that they do their annual employment screenings. We monitor all of that in employee health services, also looking and making sure that safety regulations and standards are being upheld at every area of that facility, especially as it relates to your healthcare workforce. And so some additional focus areas to explore. Let me pull this up and make it a little bigger. All right. So they can also focus on emergency preparedness as an OHS specialist, risk assessment, compliance monitoring. So the same way that we monitor to make sure that we're meeting our quality improvement metrics from the patient care side, we also have auditors that look at our health workforce. So making sure that people are TB free. That's a big thing that they screen for, that you have your MMR vaccinations, especially if you're working directly at the bedside, that you are healthy to serve patients, And so a healthcare entity is not only as strong as its patients, but also as its healthcare workforce. Safety training, so knowing what to do in the event of emergency, should something like natural disaster happen, or even internally like a gas attack. I'm just thinking from the top of my head at this moment. But knowing what to do in such situations, your OHS specialist can help you with that. And so when we explore more into the job description, let's talk about their role in great detail as far as the tasks that they're responsible for completing. So one, you have hazardous identification. So going around the facility and looking to make sure that the environment is safe. If there are there any faulty wires? Are there unknown substances out there that are not labeled that you need to label? Even down to just liquids. You shouldn't touch a random liquid, especially when you're in a healthcare setting like a hospital, because you never know what it may be. Knowing also that certain liquids look the same. So you may have a medication that may look the same as a urine. I've seen that. So your OHS specialists are very much involved in looking at hazard identification areas, risk assessment. So looking at potential areas of risk, how do we mitigate them? How do we prevent them from being an issue? Compliance monitoring, safety training, as I stated earlier as well. In addition, they may do investigations, and aeronomics is a big one. So even down to your office equipment, so like your chairs that you sit in, especially our administrative professionals, you're sitting at a particular position for long periods of time, making sure you have the right chair that is giving you proper back support, even down to your mouse, having the appropriate mouse that prevents like carpal tunnel in your hand. And so many people are not familiar with this role, but it's a very instrumental role to the overall healthcare system. And so if you are a person where you're like, this is interesting, then I highly encourage you to go ahead and apply to the job as long as you meet the qualifications. And then safety program development. So creating programs to always continuously uphold safety as well as emergency preparedness. So how do we evacuate the building should there be a natural disaster happening? How do we take patients in the same way? So I worked at a facility where it was like I won't say it was a hurricane, but it was significant flooding, and we had to evacuate the building and what that looked like as far as transporting patients. Because remember, not all patients are capable of walking down the steps. You have those who are bedbound. So just keeping those things in mind, we always have to think about that when you're an OHS specialist to ensure that these things still go smoothly, although we're in the midst of a disaster. And so when it comes to the educational requirements, at minimum, you should have a bachelor's degree, and you can get your bachelor's in either environmental health, which is another industry that kind of like closely mirrors or works with like your healthcare administration professionals, management professionals, even clinical professionals as well. Industrial hygiene is another good area, or occupational health. So there are bachelor's degrees that focus in occupational health and safety. So that may be the best degree to get if you're interested in this role. Okay, now if you don't have a bachelor's degree, but you're like, yes, this sounds like a role for me. I have a formalized degree in another area, but I want to transition or pivot into OHS specialty. Then there are some certifications that you can acquire, and certs are always good to have. So the first one that I saw was the Certified Safety Professionals, so the CSP, and this is offered by the Board of Certified Safety Professionals. And with the certification, just making sure that you know the standards when it comes to safety management, and hazard control. Another certification that's really good for this role is the Occupational Health and Safety Technologist, right? And this also by the same Board of Certified Safety Professionals as well. And with this particular cert, they're looking at the technical aspects of occupational health and safety. So it covers things like equipment, emergency response, hazard identification, and the list goes on and on. Another good cert is Certified Environmental Safety and Health Trainer. And so training is also another very instrumental sector of the healthcare industry. And I was a trainer for 3 years in a hospital, and actually 2 years, not three. It was 2 years. I worked as a trainer. So I did everything from new employee orientation down to training physicians on like emergency preparedness, PPE. So how do you properly don your protective equipment, things you should not do when it comes to putting on this protective equipment. I did affiliations, working with residents, interns. So I had enjoyed that role to a certain extent because it allowed me to really learn about the inpatient side in great detail. That was my second time working in an inpatient facility, but my first time working there full time. So the other time when I was based in New York, I used to do also training, but I would train the first and second year of residents at Cornell and New York Presbyterian and making sure that they get their geriatric rotation. So every now and then I would have to go to the hospital and train them, but I didn't work there full time. So when I came to Houston and I worked for that hospital, it was really nice to see all areas of the inpatient side. Okay, another good cert as well is the Certified Aeronomics Professional. And like I said, these are individuals who are looking at office design, looking at the equipment, making sure that it's appropriate for staff to use, like your chairs are comfortable, that you have good posture, good lighting, and you really don't think those things are important until you are in need of it. Even down to looking at your office infrastructure, in the event of an emergency, can you get out of there? And so at one time I was on a committee for like looking at like occupational and office structure layout. And I remember working on the pediatric unit. And on this unit, we recognized that should there be an emergency, the way the front desk was situated, literally the office staff would get extremely hurt and nobody would know because the reception areas were so far off from the patient care room. I mean, you just kind of like when I worked on that committee, I was like, okay, I didn't even know that these are all of the things that comes into just managing people in a given office. All right. So if you're interested in this role, outside of it being called the Occupational Health and Safety Specialist, here are some additional or alternative job titles. So you have Safety Officer, which is also very common. You have Occupational Safety Coordinator, Workplace Safety Consultant, Industrial Hygienist, Risk Management Specialist. Also, if you strictly like working in the aeronautics sector, all you want to do is that all day, then you have the Aeronautics Specialist, Environmental Health and Safety Specialist as well. Now, let's talk about the money. And so across the US, on average, OHS specialists can get paid anywhere from like $70,000 to $90,000. If you're getting started, it's about $45,000 to $50,000. Once again, it's dependent on state, it's dependent on the organization's budget, it's dependent on how well you negotiate, your education, your experience. All right. If you have a little experience under your belt, you probably also have a cert. You probably can move into the medium income tier, which is about $60,000 to $80,000 per year. Or if you have quite a few experience or very specialized in this field, then you can really get into the six figures with this role. Now, organizations that hire OHS specialists are, of course, inpatient facilities like hospitals and healthcare systems, health insurance companies, international health organizations as well. So you can work this role internationally. And I couldn't find the salary stats for this role internationally, but I do know that they have OHS specialists. So just keep that in mind. Healthcare consulting firms, especially hire OHS specialists. And then, of course, employee workforce consulting firms as well. And so the $1,000,000 question is becoming an OHS specialist right for you? And I will tell you, this role is perfect if you are a person who will enjoy helping healthcare organizations really create wellness solutions to keep their workforce safe. So you like coming up with out of the box or new ideas to keep the organization safe. You work well with people, you have foresight, you are been abreast in training people or managing staff. This is all qualities that go into this role. So that is all that I have for today's presentation. So now I'm going to convert it over to Q&A. If you are tuning in, I am very much live tonight. Thank you for joining. And I'm going to go to the queue, but I'll also have my phone here. So let me check on LinkedIn to see if there are any questions from people. Let me see. Okay, let's see. All right, I don't see anything on LinkedIn, so it doesn't have to be a long live tonight. I can wrap it up here. But once again, thank you all for tuning in, and I will be back tomorrow for Careermas Day 13. And until then, have an amazing rest of your night, and bye for now.